There has been an influenza virus outbreak in one of the inpatient units of the North Bay Regional Health Centre. Thus, a high-risk influenza status has been declared. People who visit the Regional Health Centre are encouraged to have received their flu shot beforehand. As well, visitors encouraged to wear personal protective equipment, including a mask. As well, washing hands frequently before and after your visit.
We do have some patients who have influenza, and we've had to implement enhanced measures throughout the hospital. When we do see an increase in activity, we declare what is called a high-risk influenza status.
So would you recommend people stay away from the hospital unless you really need to be here?
So of course, our business is healthcare, so if patients do need medical care, by all means, they should be coming to the hospital. We would like them to familiarize themselves with other avenues, so that would be their family physician, walk-in clinics, telemedicine. Visitors to the hospital, we ask that they do be patient with us. We do have signage posted throughout the hospital, and we ask everyone to reinforce their own personal infection control measures. Hand washing, wearing personal protective equipment if it's advised. And we do recommend, if they are feeling unwell, that they do postpone their visit to a loved one and friends.
As we hear from Dr. Tim Percival, who is the Chief of Emergency Medicine at the North Bay Regional Health Centre, getting the flu shot is not a foolproof way to prevent the flu.
Unfortunately, this is one of the years where the match has not been particularly good with the flu strain that's circulating, but we still encourage people to get their flu shots, as it may decrease the length and duration of their symptoms and make them less severe. Even in years where it's not a completely good match, there's still some benefit to getting the flu shot. So we still encourage people to get their flu shot if it's available.
This high-risk influenza status is slowing down the emergency department.
People can expect that they will have to wait longer than they would normally expect to, and that we appreciate their patience in doing so. We will get to everyone as quickly as we can, and the sickest people will be seen first.
Dr. Percival tells us which symptom separates the flu from other respiratory viruses.
The presence of muscle pains. So widespread muscle pains is one of the telltale signs. But the other symptoms are very similar to other respiratory viruses: cough, sneezing, sore throat, fever, typical sorts of symptoms.
What should you do if you believe that you have the flu?
If you do have those muscle aches in particular and a high fever, if you've been in contact with someone who's been positively identified as having influenza, particularly if you're in a high-risk group, then we would encourage you to seek medical attention. There is a medication that we prescribe for people known as Tamiflu that is effective, but only effective in the first few days. Beyond that, then it's all symptomatic management and fluids and rest.
In the Northern Hemisphere, the flu typically occurs between the months of November and April. Reporting for Cogeco News, I'm Clark Heipel.